Hi, good evening, guys. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, certified exercise expert in aging adults and geriatric clinical specialist. I'm your current vice chair of the Global Health in Aging Special Interest Group by the Academy of Physical Therapy Association. So if you have any concerns, talk about like geriatrics, connect with us. So today for our Thanks God, it's Thursday for the Balance and Pulse Support Group. I have the opportunity of talking and checking in with Dr. Tiffany Shubert. Dr. Tiffany Shubert is one of our mentors and educators, very well known in the geriatric field. So we will talk about more, connect with her, and tell to us what are the different pulse and balance tips that she can share. And she is one of the most academician also talking about the OTAGO or OTAGO here in America. So majority of you guys always asking, what is it, and also what are the different things that we as clinicians can share to our clients and you as the listeners, if you are a caregiver for your family, and I hope you learn more from our talk tonight, okay? So for our Thanks God It's Thursday, we always interviewed innovator, physical therapists, and different entrepreneurs. But tonight we have our very own Dr. Tiffany Shubert, PhD from North Carolina. Good evening, Dr. Tiffany.
Good evening, Dr. Yusuf. It's so nice to be here.
You're welcome. So you can call me Jenny and I can call you Dr. Tiffany. Yeah, so it will be you pronounce it right, Dr. Yusuf. Yeah. So thank you so much for your time, Dr. Tiffany. How are you? How's the weather there in North Carolina? Am I right? Is it there in North?
Yeah, it's summer.
Wow. So you're in North Carolina, the same place with Dr. Tipa Snow.
Yes. Yep. You were exactly right. Yep.
Yeah, I just spoke with her. I just did a wonderful interview with her. Wonderful. So how are you today, Dr. Tiffany?
I'm doing great. Thank you so much.
We appreciate your time with us. And then tell us more about yourself. I know that you are the founder, the president of the Tiffany Consulting Firm, and also you are a great author, researcher, and an academician. You are always like to do more on speaker engagement and a great PhD and physical therapist. And behind the wonderful OTAGO assessment tool or balance and pulse. So tell us more about what are you being busy right now?
Yeah, well, first of all, thank you. It was a really kind introduction. So basically um, about a year ago, started a new position where I'm working on education and content. One of the things I realized was I love working with patients, love working with patients. I love doing research, but I was feeling like I didn't really have a great channel to start disseminating all the great stuff that we're learning. So I've pivoted a little bit to really focus on education and how to make sure that all of us practicing in the field have easy access to the best practices, the innovations, and to really be reinforcing that constantly. Because I think sometimes you go to a course, you learn a bunch of stuff, it's awesome. But if every single continuing education course you're taking is sort of reinforcing these similar kind of thoughts, so that we've got to be engaging our older adults and empowering them, and then we've got to be challenging them, then that will really help support best practices.
Right. That's really wonderful. And we really appreciate all the different educators and therapists in the field doing more on teaching us, especially as clinicians, because we learn from all your research, from your all wonderful articles. We read some in Jerry Notes, and also we applied all those things in our practice. So right now, so what you can be share, what kind of share of balance and pulse tips that the best exercise you always use majority of your clients?
So that's such a great question. So the very first thing that always do with every single patient is the first exercise is just education. because so many patients really don't understand that they can improve their balance. So, and then usually what I do is I always do single leg stance, and I do it very specifically because I want my patient to understand that when you walk, it's a series of single leg stances. And if they practice standing on one leg and all of a sudden they realize if they try it and they can't do it, they suddenly make that connection. Oh, oh, this is the problem. And then also because they can improve on it so quickly. And I always time them, and I was, hey, you did 3 seconds. And when I come back next week, I want you to be able to do 5 seconds or 10 seconds. And so it gives them a metric that they can do, and they can do it whenever they want. So I don't make them say, like, you have to spend 30 minutes doing this. I'm like, throughout your day, I just want you to practice this and start realizing you can do this.
Oh, that's really good. You want them to begin in something simple. That way the compliance will be easier, you know? So, oh, there is always a small wins, but still that's a big progress. That's also, I like also the one leg stance, Dr. Tiffany. I remember we have the researcher from Japan. I think that's Sakamoto, if I'm not mistaken. He specify, I explained to my clients, I always behind it. Do you know, Mrs. Smith, that this one leg stance alone of all the things I'm showing you right now is one of the best exercise they did by one of the researcher. And then, oh really? Yeah, there is a research that they did for the same ages of females, and then all of them improved their work balance, and then she was happy. Oh, just do it. Yeah, one lesson while brushing your teeth, putting makeup, practicing your sink, and then or washing dishes. Okay, I'll do that, you know. So that's really wonderful. I like that. And how do we measure those? Our functional outcome measure.
Yeah, well, it's right there, right?
Exactly,
You
right?
time, and then boom, and you can go on from there, of course, but yeah.
Yeah, it's already an exercise and a functional outcome measure itself. One
Yes.
leg stance test. And it's, I believe this is also some part of the OTAGO. Can you tell us more about the OTAGO and the certification that behind that,
Yeah,
Dr.
absolutely. So the OTAGO exercise program has actually been around a really long time. The original research was actually published in 1995, and then the 2-year follow-up was published in 1997. So, so just know it's been around a while. And in 2010, the CDC started looking at falls, older adult falls, as a public health issue. And they really wanted to address falls at that public health level. And if you're, public health is actually a really interesting space for physical therapists. We are starting to learn more and more about public health and embracing it a bit more. But it is a different model, and they tend to use programs. So when the CDC was looking at evidence-based fall prevention programs that had been validated as a full program, meaning from start to finish, and someone else had actually implemented and gotten the same results, there were really only 3 programs available. There was the OTAGO exercise program, there was Stepping On, and there was Tai Chi. So that's sort of what really sort of accelerated bringing the OTAGO exercise program to the United States. So in the original research, the program was delivered by a physical therapist. There was a follow-up study where the program was implemented by a nurse. When the CDC started asking those questions, if we could do that in the United States, we were pretty clear that that kind of a model probably does work in New Zealand, really does not work in the United States. So the focus was, okay, let's have physical therapists and physical therapy assistants deliver the program. And so part of that mechanism also was getting some training in place. So that is the training. It is available at UNC Chapel Hill. In fact, if you just Google OTAGO and UNC Chapel Hill, it'll take you to the training page. And that training, I believe, is $50, but it's a 2.5-hour training, and it'll just walk you through all of the components of the program and really sort of reinforce the key elements and thinking about fidelity. So some of the challenges with OTAGO in the United States, especially with physical therapy, has been the fact that it has a frequency and a duration that really doesn't align with how we see patients. And what I mean is, in the original research study, the physical therapist saw the patient on a Wednesday, and then they would come back the following Wednesday, and then they would wait 2 weeks and then see the patient on a Wednesday. And then they would wait 2 more weeks, see the patient on a Wednesday, and then wait another 2 weeks. So basically, over a period of 8 weeks, you would see the patient 5 times, at which point you would really sort of let the patient go onto a self-management phase. You wouldn't see them, but you would do monthly phone calls. So again, really tough. It doesn't really align with how we do things, but at the same time, it promotes self-efficacy because we're out of the way. Like, the patient has to do these exercises, and if they don't do them, you know pretty quickly. So, so in the United States, a couple of things that we've really looked at are, what is that optimal frequency and duration, and who should be delivering? And what we've really learned is there's so much flexibility around that, because what is important, what the key components are, is that it's structured and progressive exercise being done in standing. And so we've gotten a lot more flexible around that. So going through the training is great, super helpful. You can say that you've done it and you'll have that background. But I'm bringing this up because when you actually get to implementing, the key things are, you can be a little bit more flexible with that frequency and duration. We still recommend, like, do not work with your patient 3 times a week doing OTAGO, because they need some time to do it on their own. But you can really, we have all sorts of models out there where the PT does the initial screening, and we've had, PTAs implement. We've actually had some really interesting models in Oregon where a personal trainer implements. So the PT does the initial screening and the person doesn't qualify for therapy. But then through an area agency on aging, they're actually paying a personal trainer to work with someone. So it's sort of a nice way to just disseminate. We have people doing Zoom OTAGO. I mean, we got in the Jerry Notes, the Mabert issue of Jerry Notes, there's a really nice study of OTAGO being implemented in a skilled nursing facility in a group setting. So lots of variation there, but the key piece is that structured and progressive exercise. Do not change the exercises. That's where people really lose that secret sauce.
Okay. So, and also in the OTAGO website, and I believe I did mine on the Academy of Physical Therapy Association, and then it will provide you guys to the link, which is also in North Chapel Hill. And that time, it's correct, it's around 2.5 hours, Dr. Tiffany, and around 30 that time. But if you are before, so I don't know that they increase now, maybe of course every year it might increase. They have very wonderful references for the video, sample exercises. And then I believe this is covered by even Medicare, right? Doctor, how does it regarding reimbursement, especially for our home health and also Medicare fee?
Yeah, so there's no hard and fast rules around this. Of course, you have to demonstrate medical necessity. Of course, you need to do all the things that we normally do in order to get reimbursed. So if you have a patient who, would benefit from OTAGO, but can't, doesn't really qualify for medical necessity, of course, that wouldn't be. And then there's other options. That's when you look at more either private pay or you look at partnering with different organizations.
Okay. Yeah, it can be like a maintenance and wellness level, so that will be more cash pay, like a mobile PT. All right, private pay. But if you see that they are really medically homebound, that will be medical, Medicare related. Okay, that's really straightforward. And then also the complaints of some of the therapists is that the calling, the follow-up are not already reimbursed or not covered. So that's only but it's part of the program, that you need to follow up.
It is. And again, what we don't want to do is put all these barriers in place. So again, we've gotten much more flexible. We all know that if we're accountable, like if somebody's going to call us and ask us if we've done our exercises, we're probably going to do our exercises, right? So, so it is a great practice to do, but if that is a barrier to implementation, then it doesn't actually have to be done. We've also had some really interesting innovations where there's some larger home health companies that already go ahead and do a follow-up phone call a month after discharge. So we've just piggybacked OTAGO onto that. It's a great way just in general, just to check in, but, or you have your scheduling person call and check in. So again, that shouldn't be a barrier, but we all know it's a best practice.
Yes, yes. And we always do, even it's not really the OTAGO program, we have the normal routine. It depends on the company to do a follow-up. Once they are discharged, they have this routine if they want, especially if they have a private company, private clinic, like are you already having issues again of falling near trips or falls, you might consider of coming back or checking in again.
Yeah.
So it depends. I agree. It depends on their needs. Risk of rehospitalization can be prevented because you did a follow-up and you educate them that you need to continue your education or be compliant with more exercises. So
Yep.
that's really good. Thank you so much for sharing that, OTAGO, Dr. Tiffany. How about any other programs that you're doing, or any books or other courses that you are doing currently right now that you want to share for our clinicians and members who are watching, that will be very, very good for us as a resources?
Yeah. A couple of things that are happening right now, which are really interesting, are, obviously with the pandemic, a lot of things shifted. And so we've been working with the National Council on Aging and looking at the National Council on Aging took a bunch of their evidence-based programs and made them virtual, and looking at how that impacted delivery systems. And we're finding that there's this really interesting space for physical therapists now, especially those in home health, where, we're always trying to build that bridge, right? Okay, you're done with therapy. We've got to build that connection to the community. We got to get you to a senior center. Well, now what we're finding, and that's always really hard, right? Because not everybody can get to a senior center. But now we have all of these programs online and we're in the house. And so now, instead of sort of saying, call up the senior center and work it out, we can say, let's sit down, let's find a program for you, and let's do it. So we're really looking at that as an opportunity. And there's some interesting partnering going on as well with both the YMCA and Silver Sneakers around that. So, and I would just really urge all of your listeners to be thinking about that. Like, what could I be doing now with my patient, especially if they have internet and they have computer and all that stuff, to help support their journey. And there's so many things out there. So, I'm with a great group that's going to be presenting at combined sections on that topic. And I think it's a really rich topic with a lot of opportunity.
Wonderful. Yes, I'm sure majority of our clinicians right now are always looking forward for different innovation. And as a matter of fact, Dr. Tiffany, I just interviewed a wonderful innovator. She includes gamification and virtual reality in doing neuro rehab, So that's really wonderful. It's fun, and at the same time, the client is enjoying and very effective. And that's also decreasing falls, improve their balance in that kind of approach.
Yes.
So there are a lot. So that's really good. How about books? What are the different books that motivates you as a very good academician and a physical therapist? What is your favorite books and courses that you recommend to us for us to grow more as a clinician?
Oh, that's a good question. To be 100% honest, at this point in my career, I am constantly on the APTA website. And actually what I'm really trying to learn and educate myself about a bunch more is policy and regulation. And because I really feel like we're in a really tricky situation right now with how Congress is viewing how physical therapists are paid via Medicare. So I'm doing a big deep dive into that and really understanding what my responsibilities are to the profession and to make sure that we have a voice. So I'm really doing a much deeper dive into that space than I ever have before. And even though it's not necessarily clinically applied, it's so important. So
Wow. Yeah, I didn't see that coming, Dr. Tiffany. We
yeah,
always see
sorry.
that is clinically, right? Yeah,
I want to
because I
keep you on your
didn't know.
toes, Jenny. Come on.
What was that?
I want to keep you on your toes.
Yeah. Oh, wow. That's really good because it's really a challenge for now. Reimbursement. There's lots of changing, and then about how's the support for our physical therapy profession, and especially our different colleagues who has this clinic. How about the reimbursement? How, you know? So we really need to be an advocate of ourselves, of our profession, because in the later on, it's really our clients, our patients going to be in what do you call that, benefit on
Yeah.
those things, you know? Because
Yes.
if they limit the reimbursement, they limit the services were provided, they limit the visits. So it's like the domino effect. So
Yes.
that's really good
Yeah.
knowing that, because I always see you like more on research, balance and falls, clinical, professional, but this time it's, yeah, as you said, it's a little bit deeper. It can
Yeah.
be a little bit um more on political, but this is still a leadership thing, you know.
Yeah, well, and also I really come finally to the realization that we cannot practice the way we want to practice unless our practice follows evidence and then our reimbursement follows evidence. And I really think one of the challenges we face is we sort of fell into this situation where maybe reimbursement is driving practice more than evidence. So because I think we all actually really know how to treat our patients and know what they need, but we're really sort of have a lot of barriers around that. So if we can start removing those, it would be really great because it is all about the patient.
Yes, yes, it's all about the patient, and it's all coming, goes back to them. And also when we are able to support them and coming back, we also have this feeling that we're able to help more, you know, and this is the reason why they build those clinics for them to support them. And I feel bad with the pandemic that happened also. Lots of clinics have been closed because
Yeah.
of how many clinics have been affected, and also when they will not be supported for the proper reimbursement, it will hit a lot. So
Yeah.
I hope this will be really better. So what will be your main advice right now for us who are really gearing towards learning more how to do research like you? What will be the skills that we need
Oh, the skills to be a
to,
researcher.
yeah, honestly, Dr. Tiffany, I want to know more, and let if you can give us an advice, your idea of how to do like simple tips like proposals about those poster and research, so we can practice. So I know I'm talking about like the CSM or the ACRM. How can we build this strength and learning?
So those are great questions. So I would say just in your own practice, collect your outcomes data, number one. Like you absolutely have to do that because that's going to provide value on all different levels. And then from there, when you understand what your own data is and what your own passion is, stay very focused on that and start going to your state meetings and submit to your state meetings. And it's so important that you stay with your passion, because if you don't, things get diluted. But if you're super passionate about balance and falls or improving the care of older adults, or, what kind of strategies are most effective for people with working with people with dementia, like start collecting that outcomes data, show that, by this number of visits at this level of intensity, getting this amount of dose, here's what this patient did. And this is so important because we do not have enough clinicians, boots on the ground, who are doing this. And as a result, you get the researchers, who aren't the boots on the ground, and they may not be asking the right questions, whereas the people who are interacting with the patients know what the problems are and know the questions to ask. So that's like a great way to start. And then when you start thinking about the bigger meetings, it's just critical to have a mentor. It's just, it helps. I mean, first of all, from the researcher point of view, I'm always looking for partners. Like I want to be talking to people who are practicing, who want to learn more, who want to figure the start part out. But if you have a mentor, it just streamlines the whole process, because there's just certain things, we get all this training in how to say things just the right way. And it's not even all that important, but it's just the right way to get something approved. And I bring this up because I've actually had this experience with a brilliant clinician. I think one of the smartest clinicians I've ever worked with. And she'd submitted to CSM and submitted to CSM. And then when she and I sat down together and collaborated, and I just was able to give her a little guidance, she got accepted. And it was a wonderful, wonderful thing, because because I was able to give just a little bit of more of the research context behind it, but then she came with this amazing, clinical piece that just was brilliant. So, and don't get intimidated. That's the most important thing.
Okay. Yeah, those are wonderful tips. You just make it simple first, and then collecting data, and then later on the conclusion.
Yeah.
And then if you want a bigger projects, collaboration, and a mentor, and that make it easier. That's really good, because I believe being a physical therapist, occupational therapist, they have already the skill, but we just need to learn more on a specific channel or funnel, how to do those kinds of projects that we want to. Thank you so much for those tips. So I always ask this question, Dr. Tiffany, in my interview. So what keeps you moving? What is your passion that makes you keep continuing what you're doing right now? And that is more on professionally. And what about physically?
Okay. So professionally, the thing that keeps me moving is I just, I feel like we have so much to give to the aging population, and the aging population has so much more to give back to us. So my thing is, I just want to keep those opportunities open, and keep people, especially now, realizing that they can age in place, that they do have power over their health. And I feel like healthcare to older adults is incredibly disempowering, and just being able to create that space of no, you are in charge. And I want to facilitate that. So, and I just love educating people. So that's partnering. I think educating people isn't quite the right word, but just being able to interact with clinicians and just help open up doors and remove barriers. So,
that's cool.
And then the second part was physically, what do I do?
Yeah. Okay. What keeps you moving physically?
So I run every day, and that keeps me pretty happy. And that it's interesting. I've been a lifelong runner, and then I had a terrible injury, took a bunch of time off, and then that's been the one of the silver linings of COVID is I was like, okay, I'm just going to start running every day and see what happens. And yeah, I'm pretty much running every day, and it's really great.
Wow, that's really wonderful, because that's really makes you up and about, the serotonin, the happy hormones with that. That's amazing. We really need that with this pandemic. It increased our depression mode. Oh my goodness.
Yeah.
So here in Delaware, we're a little bit more open. We don't even wear masks if it depends if you're vaccinated in some areas, things like that. It gives us more opportunity to do this out, running and going to the park better than the last 2020. So thank you so much, Dr. Tiffany. So how can we connect with you?
I'm always available via email. So yeah, and it's Tiffany at Shubert Consulting, and it's SHUBERT consulting.net. So yeah, and I love chatting with people and learning, and yeah, so reach out whenever.
Thank you so much, Dr. Tiffany. So if you have any projects, any future courses that you want, share it with us. And also, guys, if you have any questions, if you are gearing towards doing research and you're looking for mentors, Dr. Tiffany is very welcome to assist us. And also, she will share her knowledge and experience, of course. Yes, thank you so much, Dr. Tiffany. Thank you so much, guys, for listening. It's me once again, Dr. Jenny, Yusuf, physical therapist and doctor of physical therapy and geriatric clinical specialist in aging adults. And if you have any concerns, questions, inquiries, connect with us with the Balance and Pulse Support Group in Aging Adults in Facebook and also in Physican PT and Wellness YouTube. So our interviews are all available and you can connect always with us. All right. Bye for now, guys, and you have a blessed day and always be safe. God bless.